Hello, my name is Rian Stackpoole and I am the Facility Director here at the Birch Forest Nursing Home. This PowerPoint is going to cover our safety controls and policies that we have in place to make sure our residents are protected from system and staff errors, as well as how we go about fixing our errors. With that said, let's begin. So recently, here at the Birch Forest, we have been accredited from the Joint Commission. They have inspected our facility and have looked at our safety protocols and have given us the approval to open our doors to residents. To touch on our staffing requirements, we ensure that our staff is qualified not only by their state license, but also require them to showcase teamwork, initiative, empathy, and critical thinking. We also have staff complete monthly learning modules on daily tasks and procedures to make sure no steps are missed over time to ensure the safety of all of our residents. The staffing ratio here is 1:4 to make sure our nurses and techs do not feel overburdened with patient overloads and to also enable them to spend more time with patients to build relationships with them. For our staffing shifts, the nurses and techs work 12-hour shifts. Having only 2 shifts per day allows for less handoffs of the residents' care plans and therefore less lost information between shift change. For our physical therapists and occupational therapists, they work 8-hour shifts because they do not handle the residents' medication and daily care requirements. Alright, our team model here at the Birch Forest uses the interprofessional model. This model allows all staff to be on the same page with the patient's care and allows for a cohesive, integrated care. Everyone has their own responsibilities within their scope of practice, but the teamwork and collaboration between healthcare professionals allows for patient-centered care that does not result in fragmented care. For example, the nurse and techs work very closely together to make sure the patient is safe, clean, and comfortable throughout the day. Before OT sees the resident, they check in with the nurse to ask if the patient wants to do OT at this time and make sure the patient is prepared to start. Then, OT comes to see residents to help them with daily living activities, making sure they practice them and report to the nurse how well they are doing. Afterwards, the dietitian comes around to see how well the resident has been following their diet and checks in with the nurse to confirm this, rather than just leaving after their encounter with the resident. All of communication between different healthcare professionals offers a flow of information that is in constant confirmation to offer the best care to them. Understanding system failures. We understand that Latin errors lead to active ones, and we make sure to remind our staff that the single prominent active error is not felt by just themselves, but also by those who contributed with Latin errors. Not following all steps of a procedure lead to active errors. For example, a nurse does not ask all of the fall risk questions and does not follow the fall risk assessments. The resident is not labeled as a fall risk in the charting system and does not have a bed alarm put underneath them in bed. The patient gets restless after some time in bed and decides to get up without pressing the call light, and no staff is around to assist them. They end up falling to the floor but are able to press their fall alert band, and the staff are able to help them from there. If the correct steps in the fall assessment were all completed, then this resident would have had a bed alarm underneath them, which could have prevented them from falling by alerting the staff sooner. Continuing on, we also make sure to emphasize our staff that is not their fault for active errors, and that is a combination of other Latin errors that have led up to this one. Errors that have accumulated over all members of our staff, including the nurses, techs, physical therapists, and APPs that see our residents. We focus on the root cause of our errors instead of trying to fix mistakes. This focus on the origin of the problem allows us to remove the error from happening again. Alright, anticipatory failure analysis methods. Some anticipatory patient safety systems that our nursing home utilizes include HFMEA, Healthcare Effect Mode and Failure Analysis. This system is used to prevent an error from occurring again and uses the same 5 steps. We define the topic, assemble the multidisciplinary team, such as an MTO team, graphically describe the process, conduct a hazard analysis, and describe actions and countermeasures. FTA, or a fault tree analysis, is a system that uses a retroactive approach by putting a main error at the top of the diagram and thinking of steps that can lead to this error. These are all hypothesized undesired events. This is used to think of ways a process can go wrong before it goes wrong. So, what is an MTO team and what do they do? An MTO team is made up of healthcare professionals that are a part of our facility. They go through a short amount of training to ready themselves to analyze patient safety errors that have already occurred. For the MTO team to be successful, they read all the incident reports left by the staff that were present during the active error, as well as the direct contributors of the active error. They will then interview each person individually to get a more detailed explanation of what happened that led to this active error. The MTO team then compiles all their gathered information into an event chain to try and see where the cracks in the system are and find solutions to fix them, so this error does not happen again. Okay, so how is our nursing home going about collecting data that we deem important? So in our nursing home, we have decided to track the number of falls, hygiene compliance rates such as hand hygiene and wearing the appropriate PPE for certain infection control, as well as tracking UTI infections and Candida auris. Being able to track when and where these infections occur is important information that is utilized by our MTO team to help them come to quicker conclusions to where this problem is coming from. It is important to us that nurses and other staff report these infections and any other findings that they see as hazardous. Reporting near misses. Near misses are almost always never reported in healthcare facilities because the staff does not want to have to do paperwork for something that did not cause injury to themselves or the patient. So an example of a near miss could be something like a nurse helping a patient or a resident get out of bed. They stumble, almost fall, the nurse catches them. There is no fall. They help them to the bathroom, help them back in bed, and that was the end of the encounter. That would be something as a near miss. Or, for instance, if there is a combative resident and the resident almost hits you or a coworker and you see it, that is another near miss. However, here at the Birch Forest, we make sure that our staff understands the importance of reporting near misses. These incident reports for near misses allows more data for our root cause analysis team to utilize and to figure out how these near misses occur and solutions to prevent them. Staff have the option to remain anonymous when completing a near miss report. Okay, moving on to monthly staff meetings. There are monthly staff meetings on the first of every month. In these meetings, the staff and managers meet together to discuss what has and what has not gone well over the past month. Examples of concerns may be about the nurses' assignments or problems with supplies not being stocked. There are also monthly meetings for the residents every 15th of the month where they are allowed to voice their concerns to the staff. Examples of these can range from who they are living with, if they share a room, or concerns about the food, or even not having enough activities planned to do throughout the day. Okay, addressing private concerns. It is inevitable that some sort of conflict will arise between coworkers. Making sure the environment is safe and teamwork oriented is very important to us, so having a way to address concerns between coworkers is necessary to keep that environment friendly. There are QR codes posted on our bulletin board for our staff to fill out. They can either remain anonymous for slight problems that are occurring around the unit that may not pertain to them, but they also have the option to leave their name down so they can have a one-to-one conversation with the manager to help come to a solution. And in these QR codes is basically just a little fill in the blank to address what you want to talk about, anything that's concerning you, and then that can be brought up to the manager if you do want to leave your name, or it can be addressed to the whole unit if it is anonymous. And keeping a friendly environment is beneficial to make sure staff is comfortable asking for help when they need it. This also helps reduce errors from being made. Patient health literacy. The staff are here to help the residents understand what medication they are taking and to help them understand the why. Allowing the residents to be well informed about their medication and care plan is just as important as the other safety protocols that we have here. For example, if a patient is on a medication such as Lasix that is making them urinate a lot, or a stool softener because they have not had a bowel movement in a while, it is important to explain to them the effects that medication is going to have on them so they understand and can be prepared. Other patient safety controls. Each resident that enters our facility is equipped with an ID band that has their ID number, name, and date of birth on it. The wristband lets the staff scan it to ensure they are administering the correct medication to each patient. It is used as a double verification, and they will not be allowed to administer the medication until they do scan an ID. They also will wear a fall alert band. If a resident were to fall somewhere where they cannot be seen, they can press the button on the band and it will start an alarm that will alert the staff to their location to help them up and assess them. Continuing on with other patient safety controls, for patients that get confused at night or have a hard time remembering to press the call light button when they need help and they are at risk for falling, these patients will have a bed alarm placed underneath them, which will activate an alarm from their rooms, and the nurse is going to assist them if they do get up from their bed without anyone nearby. There is also a bulletin board that has the facility's policies and procedures and step processes, so the nurses, techs, and other staff can refer back to. This is going to help so they don't need to rely on their memory. This board serves to help reduce skill, rule, and knowledge-based errors. And lastly, to quickly go over culture of our nursing home, here at the Birch Forest, our culture here is patient care and patient safety oriented. We want to think of solutions before they occur and continue to think of ways to make processes safer for our residents. As mentioned before, the staff here is one big interprofessional team that is ready to help and work together to achieve a common goal of making sure our residents are staying healthy. Our MTO team, anticipatory safety systems, safety policies, controls, and barriers all contribute into making a successful and safe environment. I would definitely consider the Birch Forest as a place to care for my loved ones when they can no longer care for themselves on their own. Alrighty, this brings us to the end of our review of the Birch Forest Nursing Home Facility. Thank you very much for listening. I look forward to meeting everyone that is interested in coming to take a tour at our facility and considering joining us. Take care.